Hello, everybody, and welcome to Campbellsville University's Political Science Senior Seminar Roundtable discussions on policy and political events that are important to you. My name is Dr. Sean Williams, and I'm the host and moderator for this program, which is, I believe, in its 5th or 6th season. Today, I am joined by a wonderful panel of experts to talk about single-payer healthcare today. And I think this is the at least second or third time that each of our panelists have joined us. So from my top to my bottom of my screen, we have joining us Lydia Manley. Ms. Manley, how are you today?
I'm good. How are you?
Doing fantastic. We also have Carson Kowalik. Carson, how are you?
I'm doing well. How are you?
Doing fantastic. Also joining us here from Campbellsville is Howard Smith. Howard, how's your day going so far?
It's going pretty good,
And rounding out our top four, our expert on healthcare, Hunter Wilson. Mr. Wilson, welcome to the show.
Thank you, sir.
But today we're going to be talking about single-payer healthcare, and I think of the topics that we've discussed so far, this might be the one that could be potentially most relevant to the current presidential cycle. As we are live streaming this, we are a little bit less than 2 weeks away from the presidential election. Actually, we're on the night of the third and final presidential debate, and healthcare should be an issue that comes up. Now, when we're talking about single-payer healthcare broadly, or approaches to single-payer healthcare, this is actually a policy issue that was widely discussed during the Democratic Party's confirmation or a nomination process. And if you take a look at the polls, what most polling numbers suggest is that the idea of something like a single-payer healthcare plan seems to be relatively popular among the American people, regularly scoring over 50% popular support as an improvement upon the existing Obamacare system. And so today what we're going to do is we're going to spend a little bit of time talking about single-payer, understand maybe a little bit what it is, and then also talk a little bit about whether or not it would be good for America. So this is a question open to anybody to get it started. So what exactly is single-payer healthcare, and how would it be a change from what we have in our current healthcare system?
I can go ahead and start off with that and give kind of a general definition. But single-payer healthcare is a type of universal healthcare in which costs of essential healthcare for all residents are covered by a single public system. Single-payer refers to the mechanism in which you pay for healthcare or through a single public authority. So the idea is that you pay through a single government entity through, let's say, taxes.
And how is something like this different than how our system's constructed today?
The U.S. has sort of a hybrid system, I would say. So we have like some public healthcare, whereas some private. And so like we have like money that goes into healthcare, but then people can choose their own form of private healthcare, which is primarily what a lot of Americans opt to do. So just more of a hybrid system. Like we have that public access, but private as well.
I don't know if many of the viewers or most of the viewers would think of our system as being hybrid. What are some of the components of the hybrid portion or the government portion? In what ways does the government actually pay for or provide for healthcare now?
Well, we pay into like Medicare and Medicaid, which is like that public access. So if you don't have access to adequate health care, then you are eligible for Medicare or Medicaid under our current system. And we don't really think of it as a public aspect of healthcare, but it like the way it runs and like plays out sort of is because we pay into it like through taxes.
Yeah, and just kind of going off that, just for like viewers that might not know, because the system can be kind of confusing. Medicare is like payroll tax shared by employees and employers, and federal like general tax revenue, and then Medicaid is just federal and state tax, and then of course private insurance is premiums paid to the insurers. So.
Thanks for clearing that up.
Yeah.
So what if we have this current hybrid system, and I think at least a few years ago, about half of all healthcare dollars were initially being spent by the federal government, either for Medicare, Medicaid, or also for the Veterans Affairs VA benefits. What are the strengths and weaknesses of the system that we have right now, this hybrid approach as y'all describe it? And why do so many Americans want to transition to something that's more like a full payer system rather than the hybrid that we have today?
I don't necessarily know if a lot of Americans want to switch over. I think a lot of issues that people have with like maybe a single payer healthcare system is that they don't want to lose their adequate access, because people who have that private insurance have a better quality access to healthcare. And so it kind of, I don't know if a large amount, I think it just depends on if you are wealthier or if you aren't, because having adequate healthcare is usually, in my opinion, if you have private insurance, just based on the research that I did covering the US and how people access their healthcare.
I'll have to.
You can go ahead if you need to.
No, you're good. Go ahead.
Oh, but just to chime in on that, when it comes to things like healthcare, you can basically dumb it down to just regular costs of everyday life. If you can afford the better things, you're going to try to get those better things for yourself and your family. So when it comes to healthcare, if you can afford that better healthcare, you're going to want to keep it. Even though overall the single payer healthcare sounds very popular to most people, because a lot of people, especially in this country, going right now when it comes to the lower middle class and below that line, they need that single payer healthcare to make sure they receive the healthcare they need. But most people that are above that line that have that adequate healthcare and even receive healthcare from their occupation, where it comes with the dental plan and health plans and things like that, they will want to try to keep that. But overall, as far as a whole in the United States, a lot of people are really starting to favor single payer healthcare because it receives universal healthcare for everybody. That's just to chime in on that.
Yeah, I'll agree with Carson and Howard on that. It's good healthcare as far as private healthcare goes, as long as you can afford it. That's really the key or the barrier to entry there. And private insurance holds several advantages, such as the coverage of non-essential procedures or the ability to choose physicians in the hospital and shorter waiting times. But again, the key is affording it. This is assuming you can afford this coverage.
Yeah, you go, Lydia.
I think the U.S. is kind of in this balance of, do we go full single payer or do we go private, because we're in this hybrid system, and you just have to kind of weigh out, do the majority of people rather have the single or the private healthcare with the benefits, or do we go for the more equality route with the single payer?
To bounce off of that, I kind of think that it's kind of a catch-22. So with single payer healthcare, research based, the U.S. has a higher mortality rate than other comparable countries, and it's primarily due to those countries having universal healthcare, and so that kind of creates a discrepancy in the U.S. because people who have access to the private healthcare are going to be healthier because they can go to the doctor whenever they want to, but then the people who don't have the money to pay for healthcare, they just don't go until it's the very last minute, and then they go to the emergency room and then it's too late. So it's just kind of it can be beneficial, but it's which positivity do you want from it? Do you want everyone to have access, but then the adequacy of it, does it go down when we switch? It's just kind of, what do we choose?
So that death rate you mentioned, is it because that people aren't going to get the care they need in time? Is it for those people who aren't covered? Or is it for the people who are getting the healthcare or the medical needs as they come in?
So I kind of think it's they don't want to, they go like at the very last minute because they don't like pay into healthcare and they don't have the public access either. And so then they're going at the very last minute. I mean, I have family members who have gone like at the very last minute, and then it's like created like other problems because they waited so long. So other like prolonged like issues arose. And so it just is like a like stepping stone of just worse whenever you don't have access.
Yeah, and sometimes, you're saying they go to the last minute to the emergency room. Sometimes it's not even the last minute. It's just the fact that either their insurance is very poor or they don't really have it. And so even for like minor things like cold, flu, I know in like at least a lot of small towns where they don't have like urgent cares, they'll just go to the ER, which honestly muddles the system even more for people who are there for actual emergencies.
Would you think that a good analogy from listening to y'all's conversation would be the difference between doing regular maintenance on an automobile or only trying to fix problems when you have a major catastrophe? Like, which would be more expensive, always getting your tires rotated or having to constantly replace your tires because they're never being rotated? Does that sound about right?
Right. Yeah.
Right.
I think that's where we were like going with that. That's a good like analogy.
So you guys have kind of touched about this a little bit with the mortality rate being a little bit higher in the United States than it is in comparable countries. I think the United States is just about the only industrialized country that doesn't offer at least an 80% hybrid for healthcare. Are there any other indicators to suggest that a single payer system could provide a better health outcomes than the system we have now, or that you might have worse outcomes depending how you measure them? What are we looking at?
In my opinion, when you look on the surface of it, when you just think of general healthcare, I think by default, people are going to be healthier. I think by default, the mortality rate would go down because people will be able to afford simple things like over-the-counter medicine and things of that nature. But I feel like if you like want to dig truly deep into it, when you think about deeper complications and deeper surgeries, I feel like it's still going to be issues from where that lower class or that poverty line, when they have serious issues like maybe develop something wrong with their lungs or something like that cause more money and more input, it still might be an issue there. But other than that, when it comes to on the surface of things like shots and things and getting over-counter medicines for simple sicknesses, I think the American public would be more healthier, but also digging deeper, it might still be an issue. But overall, I think the single payer healthcare will provide a healthier population for America.
Howard, how would that affect like the hospital costs?
When it comes to the hospital costs, because when hospitals and insurance companies work together, it's basically like a three-pronged thing. They work with the patient to see what type of healthcare they'll need. Then they work with their insurance company to get their fees reduced and have their payments covered, while also the insurance company work with the patient to find like a good happy medium for the insurance part of the payment and the patient's part of the payment, because it's a co-payment. And the hospital try to provide the best care they can while also making money in their mind. So when it comes to all three, it kind of all works as they want the best for each other, but also for themselves. Like the insurance company wants the best value for their patient, but also they make their money. Hospitals want the best value for their business, but make sure the patient is taken care of, and the patient just wants the best deal. So when it comes to that, the single payer is the government controlling all of that cost and all of that fee. So it's basically like the hospital will have to deal with that fee and what that patient has to do, because nobody's competing. There's no competition for that patient. So it's just they have to deal with that one price.
I think if we look back to the 2020 Democratic campaign, and really for the viewers who are old enough to remember, rather, the 2008 campaign between Obama and McCain, where healthcare reform figured prominently, this question of costs, specifically costs to the average Americans, always comes up. Would something like single payer or something like Medicare for all, is it on balance more expensive, or is it on balance cheaper than the current hybrid system that we have right now?
I feel like it'll be more expensive, especially as the start, because the government at the beginning will have to put all that money into the funding to start it up. So taxes are going to be raised and things such of that nature. But I feel like as time goes on, I think people will kind of get used to that tax raise, and it'll slowly start to decline just over time, because I feel like people are going to make more money and the economy just going to keep on booming, just because that's how America is. We always find a way to be one of the economic top notch in the world. But I feel like at the beginning, it would be more expensive than obviously the multi-payer and the hybrid system we have now. But I feel like the single payer health system will work out eventually when it comes to that type of cost.
So when it comes to like the numbers of it, I was doing some research about this, just, outweighing the pros and cons, and really just like how much more a single payer would cost. And so I found an article that said, a complete single payer system could add up to $700 billion deficit increase in the next 2 years, and could cause taxes to go up even as high as 20%. Especially in a like Medicare for all system like Senator Sanders is pushing for, and could even push payroll tax up to 6.2% more.
With the extra taxes that we have to pay, would that be in addition to people's current healthcare expenses, or does that replace existing healthcare expenses?
I was going to say, I think that like if you are already paying into you have your own private insurance, I don't know if maybe they would be paying like a lesser or same amount. I didn't really do research on it, but I feel like if we switch to a single payer healthcare system, that the people who are already paying for their private insurance, like maybe they wouldn't really see a difference in like the amount of money they're spending. They would see a difference in like the quality of healthcare they're receiving, and like wait times, and how that affects like their overall healthcare experience. I don't necessarily know specifically about numbers, but I know that that's just kind of what I'm thinking.
Yeah, that's a good.
Go ahead. Oh, okay. I definitely agree. If you're already paying for private insurance and it's being provided by your occupation, I don't think you should have to switch over to it. Of course, you might end up paying for it, right? But I think you should be able to keep that and kind of stay hybrid. I know we've been talking about if the U.S. switches over. And to kind of go off what Carson said about wait times, single payer healthcare or universal healthcare, from what I've seen in my research, does have an issue with prolonged wait times. We were talking about better outcomes, as opposed to like the U.S.'s more privatized model that we have now, which is relatively expedient in terms of care. Using like Canada as an example, which is known for universal healthcare, average wait times are like 18 to 19 weeks from seeing a medical professional to like the procedure you have to do. And by that time, you may not even qualify for what you needed in the beginning. Personally, I've never had an issue with waiting times with my insurance or my family's insurance, but it's just something to think about when we're comparing the two models.
Yeah, and kind of going off that, just, about more like pros and cons between each system. One thing that I hadn't thought about until I was doing research is like effort to innovate. And I think that kind of goes back to the mortality rate and asking the question, why is the US at a higher the lower, or that the mortality rate. And, I think one thing is that effort to innovate, and that we are so advanced in our healthcare system. And I think you have to ask, when it comes to a single payer plan, would that, go down because of, competition, funding, whether it be either of those things?
To come back to something you had mentioned earlier, Hunter, it's not necessarily the topic of our discussion, but what you were describing, this idea of a single payer system that you could opt into, that sounds a little bit like what Joe Biden is proposing. Is that accurate, or am I reading too much into it?
I'm not particularly familiar with it, but it could be. I'm kind of alluding to that, I guess, to where it's kind of this net to catch you if you don't have the proper insurance. Is that kind of like what his plan is for?
It's a great question. I'm not entirely sure I understand myself. It sounds like that the basic theory of it is that if you wanted to purchase access to Medicare right now, you can. But in the first presidential debate, he made it sound as though not everyone could buy access, that essentially only people who were lower income or lower middle income workers would be able to buy into the Medicare plan, which would essentially be, rather than requiring everyone to go to single payer, you'd be able to buy into government provided healthcare if you wanted to. But I'm not entirely sure how that would be implemented. The details haven't really been provided.
So you have to qualify in a certain way.
I'm guessing. I don't know that that's really. Yeah. Have any of you been able to find any research on that?
No, I mean, I've just seen some of the stuff about, like if you're above 400K, then you would pay into that. Like you'd pay higher taxes, which I guess the higher taxes would like kind of help pay for that. But I haven't seen specific research on like what he wants to do with the healthcare system.
But I could see that making sense because we were talking about how the more privatized insurance, the average, working American may not be able to afford that. And then something like a healthcare system you can opt into if you're kind of lower income. I can see that maybe working out, or the idea behind that at least.
Well, on balance, you guys having a bit of a sense, especially of your generation. If you were to make the offer to somebody of your generation or the American people in general, we will create a system where you don't have to worry about how you're going to pay for healthcare, but we can't guarantee you that you're going to have healthcare on demand, right? You're going to have easier access, but you can't necessarily guarantee that the store is always going to be open when you walk in the door. Do you think that that's a deal that most Americans would buy, or do you think that they would prefer the system they have now, where you can get it immediately as long as you can afford it?
I mean, I think getting it immediately is kind of part of our culture. We don't really know different. We almost get everything immediately when we want it. And so I think especially our generation just, I don't think that they would buy into the factor of, more wait times, all these possible like negative aspects of single payer. But there also is the flip side of a lot of them, would like it because of the equality aspect. So.
Yeah, I kind of think, playing off of using Canada as an example, they have like a great public healthcare system, and like even though the wait time is larger, they have a lower mortality rate than the US. And so like what's the payout that like we want? Like do we care about other people, or do we only care about ourselves? So
as far as like the acceptance of the American public, I don't think people are going to make that deal. I think I'll agree with Lydia. We're not used to having to wait for care that we need. We're so used to being like I said earlier, you go to the doctor, you get your thing taken care of, boom, if you need a procedure, you get it 2 weeks later or a month later. Everything is so expedient. To imagine it coming to like a screeching halt, I think a lot of people, it'll be a wake-up call if we switch over to that. I don't think people are aware of those downsides.
Yeah, and I think hospitals and like doctors' offices, I don't know if they would be able to handle the impact of, because once everyone has that access, they're like everyone's gonna be like, oh, I can go to the doctor now, and then like try to receive that treatment, and then the wait time is going to be even higher than like if we just had the single payer healthcare system like right now. But I don't know. I think that it would be definitely like an overwhelming like, oh my gosh, we don't know what to do. Like, and definitely high news media coverage, like in like hospitals and doctors' offices, if we did do that, obviously just for general reasons, but because I think they would be just like overwhelmed with people.
I think, Carson, you brought up a great point where now if we get like a universal healthcare where it's access to everybody, people would be like, oh my gosh, I've got a stomach ache, I can go to the doctor now and I can get medication and get it all prescribed to me. I'm paying for this, so why not just go? So I feel like there'll be this huge, like, just influx of people coming in, and then the waiting times will go up even more rather than just staying home. Of course, it could be bad to stay home too if you have an issue and be like, well, I can't afford it. But it's like this balancing act.
I mean, you could also think kind of deeper into that. Say if you're able to get this universal health care where you can qualify and it's only for the lower middle class. Now say if you're a physician or a doctor and now you have to take care of all these people because now everybody has universal health care. So one of two things is either going to happen. His profit rate is going to go down because now he can only accept one price from the government, or he could do something like have his own private practice where he can still accept private insurance companies from people that still can afford it. And he'll just deal with private insurance companies instead of having to work at a public institution. So it's all kind of this single payer healthcare all kind of trickles down into different situations, scenarios. But at the end of the day, people are buying into it because now everybody gets healthcare.
Yeah, and I think, what you're saying could possibly work in a system like Obamacare or possibly Joe Biden's plan, but in somebody's plan like Senator Sanders, he wants the private insurance, completely removed from the equation. And so I think just back to what Hunter was saying, those wait times might be, astronomical, and private insurance might not be an option for people that really want it.
Not to get too philosophical or theoretical on a relatively practical topic, but the way that you're painting the problem is really kind of interesting to me. It's almost as if I can afford my own health care, I'm really better off if other people don't get it. Right? Like if I can afford to pay for my own doctor and pay for my own access, it's really better for me if others aren't clogging up the system and taking up the bed space that I want to use. And I guess maybe our hybrid system kind of accomplishes that. I never really thought about it that way, but that's sort of the argument that you guys are making.
I don't know if that's necessarily where we're going. I see what you're saying, but I think that like what I mean and like what Hunter said, like, oh, I have a stomach ache, I can go to the hospital or I can go to my doctor because I'm paying for it. So why don't I go ahead and get that like coverage? I mean, because again, like I have family members who don't have insurance, but like I don't think that they would I don't think my family members would do that, but like there's maybe people out there like who would and like just go to the ER now, like because they have a stomach ache. And so, I mean, I know what you're saying, but I don't necessarily
I see what you're saying. You're making me seem like a villain with that analogy. But I'm just saying, I'm kind of just alluding to the idea that if you do have the funds necessary to get that kind of care, expediency, pretty good quality care, I think you should be allowed to do it. I mean, is this late stage capitalism like infecting my brain? Maybe. But I feel like if you've got that, the funds necessary, it should be available for you to, have access to it. And then if you don't, I think that's where the more government funded insurance comes into play.
And my goal was absolutely not to make anybody look like a villain. Actually, a similar logic problem exists when we're talking about building something like public freeways. Building a new highway is really, really fantastic for me if I want to get to work faster, but only if nobody but me gets to use the highway, right? Everyone uses the interstate that's been built for me to get to work more quickly, then it just makes my travel longer because of all the traffic jams. And that's almost the way that you're describing the healthcare system. A healthcare system where I can get access is exactly what I want. If I give everybody access, then maybe the healthcare system isn't as good. Another question that comes up, it's almost a philosophical question, is the relationship of the United States government to the size of the American economy. So if right now the government is responsible for about 50% of all healthcare costs, even if there's an even exchange for the costs, when the government expands into the other half of the healthcare market, the government's control over the size of our economy increases. Many conservatives, especially many libertarians, are concerned about single-payer healthcare, if only for that reason, that the government becomes even more powerful in its ability to manipulate the economy or control your personal life. Is that a legitimate concern, do you think, or do you think it's just a bunch of people who are worried about nothing?
I'd say it's a legitimate concern. Personally, I'm not particularly too worried about that. I mean, government every day has more of a stronghold on its populace. That's just the way things are, in my opinion. But in the aspect of healthcare, so in Chile, I was doing some research. They've got a universal healthcare system, and so the expedient care, it goes to those that are considered. Let me see, their medical issues are considered important, or I guess they're the main focus. Like if you have like certain cancers and stuff like that, as opposed to like needing some sort of cosmetic surgery. I think the idea that a government entity will decide what's important and what's not, and what gets you that care that you need, it's a bit of an ethical kind of dilemma. I would say that's the scary aspect of it, is the idea that a government agency is going to decide if my issues that I have are important or not. I know it's kind of a little bit off the main topic, but that's kind of like where I'm going there.
No, that's fair. I remember back in 2016, during the Obama-McCain campaign, one of the most effective anti-Obama, or not 2016 rather, I apologize, it's the 2008 campaign. One of the most effective propaganda pieces that the conservatives had against Obamacare was this idea of death panels, that somehow there'd be a person or a group of people behind the scenes saying that basically we're not going to give you the option of spending $1 million on a 10% chance of getting better. It's just not worth it. Or $2 million for a really expensive COVID treatment, whenever the chances of it working are only 10 or 15%, it's just not financially worth it for us to spend that much money on you. And I know that a lot of Americans had that concern. But what about the rest of you guys? Do you feel in any way nervous about the idea of government taking either that much control of your personal decision making or that much control over the American economy?
To be honest, I feel like the government kind of had a big kind of stronghold on the economy anyway, even though it's a free market. So truly, I'm not truly worried about it, because at the end of the day, the economy it's going to move on its own. It's a free market. It's trade everywhere in the United States. It's just kind of a free market. I doubt that the government, even though it will have so much control of the economy because of the healthcare, I feel like it won't be that too much of a difference. I feel like people are still going to be making as much money as ever. And I think it's just blowing smoke at this point, in my opinion. I don't think it's that big of a deal.
I think it kind of comes down to, each person, like where your trust lies, like how much trust do you have in the government? I mean, like Hunter was saying with, picking and choosing what's important in healthcare. I think you just have to ask yourself, do I trust them this much or do I not?
And I'll agree with Lydia on that. Do you trust them enough? Do you have that much faith in the system? Personally, I don't know. I'm a little bit shaky on the whole idea. I guess to kind of go with that dilemma you mentioned earlier, Dr. Williams, about how care is only to those who can afford it, and then everybody else kind of gets thrown to the wayside. I feel as though it's like, okay, well, do we want those who can afford to get the great quality care, or if you don't have it, well, you can kind of try your luck, sort of deal. So it's a little bit shaky in my mind.
So final question. I mentioned at the top of the broadcast that we are now, I guess, 12 days away from a presidential election, even though from what I'm reading, somewhere around a quarter of all votes have probably already been cast. But if we were to go through the election, and if Joe Biden were to win, and then to come in and try to implement either a single-payer healthcare system, because he's forced to by the Democrats in Congress, or just simply something like a public option. On balance, given everything that you guys have considered in your research and everything that you've talked about today, do you think that the United States would be better off? And if so, why? Or if not, why not? Ms. Manley, we'll go ahead and start with you.
Yeah, I mean, I think, we talked about a lot of different aspects during the broadcast. We talked about wait times. We talked about the economy. We talked about quality. And personally, I think that right now, it's just not a good idea. I think that we need a really solid plan first. And I think just like weighing out all these pros and cons, I think the cons right now just really, outweigh it. And I don't think that it would be the best option for Americans.
Mr. Wallach, what do you think?
To go off of what Lydia said, I kind of agree. I think that although the mortality rate would decrease, I think maybe our overall quality, because we wouldn't necessarily maybe have as much private insurance, and so then the quality of healthcare maybe will decrease. And also with what Lydia said, I don't think we're ready for it. I think that yes, we want that equality and everyone to have access to healthcare, but do Americans as a whole actually want that?
Mr. Wilson?
Yeah, I have to agree with Lydia on that. I don't think it's a good time to implement it. I don't know if we've got exactly a fully fledged kind of idea of where we're going to go with it. I think in the end, and then to go off Carson, it's a question of quality and access. Personally, and I feel like many Americans feel this way, I would rather be horribly in debt than deceased. And I know that sounds awful, but I'd rather be many, many dollars in debt than just not getting the care that I needed.
Well, for what it's worth, it doesn't appear that either political party really cares about debt if they're the political party who's in power. They only care about deficit spending whenever the other guy is the one who's running up the credit card bill.
Can't disagree.
Mr. Smith, you get the final word.
Just to play off basically what my other colleague said. Actually, I forgot where I read this at, but most people in America, if you truly think about it, is philosophically they're liberal, they're Democrat, but traditionally they're mostly conservative. And it's kind of where I play it on this. I mean, as much as I would like everyone to receive the proper health care they need, but when it just comes to, I mean, you could think of simple things like when I go to McDonald's and I get my own meal, it's fresh, it's cooked, it tastes good. But then when you're with a big group, where it's about 40 or 50 of us, it's kind of all slapped together. It don't really look too well. So it's basically the same thing that's going to happen with healthcare. When everybody's involved and everybody can receive that type of healthcare, the quality is going to go down. Everything's going to go down with it. So when it basically comes to, as much as I want everybody to receive healthcare and everybody to be healthy, if I have the proper healthcare to where I can be healthy on me, then we'll just have to figure out something else because I want my healthcare.
It's a pretty effective analogy. Although if you're really worried about your healthcare, don't eat at McDonald's.
No.
But so thank you everybody who joined us for this broadcast. And if you haven't had a chance to check out any of the others that we have conducted so far this season, please go and find us on YouTube. And also I would encourage you all to join us this time next week when we're going to be discussing the question of local school autonomy and whether or not empowering local teachers, principals, and superintendents would actually make education delivery in America better, or if turning off the accountability might in fact make it worse. But thank you again for joining us, and until next time, God bless.